Welcome into CommonWell TV 2021, right here from our Orlando studios. We're introducing you to some of our CommonWell Health Alliance members, including our next guest. That is Kno2 and Vice President of Interoperability. That's Matt Becker. He's joining us now. And Matt, let's start things off with Kno2's reaction to the ONC info blocking regulation that just came down.
Yeah, so I think it's definitely good for the industry. They take a lot of lessons learned from meaningful use and applied it to info blocking in a way that incentivize people to do the right thing and get us to that minimum bar of interoperability at scale across groups. What I don't think we should do is just stop at that minimum bar. And that's what I appreciate about what CommonWell does and the different work groups and different initiatives that are going on, is to rise above that minimum bar and make sure that we're doing the right thing for patients. Because it's one thing to exchange data, it's another thing to make sure that we're adding value to use cases, adding value to providers and things like that. And the info blocking only gets us so far in doing that. And so we need to take a step above that.
Matt, looking into the future, what does Kno2 see on the horizon for health IT?
So many exciting things. I think seeing the industry finally address the long tail of interoperability. I think the folks that joined early on and were able to exchange early on definitely had the money to do so. But we're really seeing like individual doctors' offices get access. We're seeing long-term care centers get access to data. And when you do that, you're really hitting the critical patients that really need that care. So the most vulnerable among us are able to see the value of the data moving back and forth. We're also moving towards more use case driven exchange, as I talked about just a second ago, specifically event notifications. So direct trust, CommonWell, care quality, moving towards how do we notify the right people when something happens to the patient so they can get that full spectrum of care that they need in order to get better and with cheaper results. And then finally, I think it's more of the payer use cases that are exciting. So I'll take prior authorization as an example. So prior authorization is when you need an expensive medication or expensive treatment, and the payer just needs to approve that in advance so that they get paid for it. The problem today is that's a lot of manual workflow. It's a lot of faxing back and forth. It's a lot of, quite frankly, just back and forth to the point where it can take weeks in order to get that done. If I'm a patient and I don't know that expensive medication is going to get covered, I could get sicker in those 2-3 weeks versus a 24-hour turnaround time when all that information is exchanged electronically with the payer and just free flowing back and forth. We need to be able to move through these spaces, and we need to concentrate to capture the whole value of the patient care, not just from hospital to hospital.
So Matt, as the Vice President of Interoperability, what are some of those hurdles right now that you see in that health IT landscape that is really preventing real true interoperability from happening?
So I think the biggest thing for me is that I want to make sure that we live in a culture where information is just easily shared at scale and it just happens. But there are a lot of reasons that organizations may not want to share. And the big problem with that is that it takes all the control out of the hands of the person that we're trying to treat. So you're trying to make the patient whole, but you're not able to move them between the different touch points of healthcare, like payers, like their own record, like them downloading their own record, plus moving from specialist to specialist. And that just hurts people overall. And so I think the future is making sure that everybody is on the same page about what's legal, about what's scalable, so that you can exchange with anybody at any time. And then really making sure we get rid of the fax. Doing it by fax or a single interface today is not the solution. It's not affordable. It's not scalable. It's not easy. And somebody can miss something important.
He's Matt Becker, the Vice President of Interoperability for Kno2, one of our proud CommonWell members. And for more information on them, as well as all of CommonWell, we invite you to log on to CommonWellAlliance.org. Matt, thanks so much.
Thank you for having me.
Thanks for watching this episode of CommonWell TV. To get the latest news and updates, follow CommonWell on Twitter. We also encourage you to subscribe to our CommonWell YouTube channel and hit the bell icon to receive notifications when a new episode is posted.